Welcome to everybody attending the IABS meeting on high pathogenicity avian influenza vaccination strategies to prevent and control HPAI, and then a very important subtitle, removing unnecessary barrier for usage. I'm Sjaak de Wit, a member of the scientific committee that was assisting the organizing committee to organize this fantastic meeting. I hope it will be a historical meeting. And I'm the moderator of the first session. Just to check, please check your mobiles whether they are on silent mode to prevent unnecessary disturbance. This meeting is organized through close collaboration between of the IABS with the WOA and FAO. And that's why I would like to give the floor to Dr. Rick Hill, President of the International Alliance for Biological Standardization.
Thank you. Good morning. On behalf of the International Alliance for Biological Standardization and all of our collaborators and sponsors, I'd like to welcome you to Vaccine Strategies to Prevent and Control High Pathogenicity Avian Influenza. It is so great to see people in a room instead of on a screen. Thank you so much for coming. It's great to be here together, face to face, in this historic location. Special thanks to the World Organization for Animal Health for their participation and hospitality. Like many IABS meetings, participants include experts from industry, academia, research, government and regulatory agencies, and international organizations. Looking at today's participant list, we are lucky to have so many interested parties here today, especially all of the chief veterinary officers who have taken time to join us. Thanks to everyone who helped organize the event. It will no doubt be an eventful meeting, and I am looking forward to your participation and the results of the conference. Thank you.
Thank you, Dr. Hill. The welcome by the World Organization for Animal Health, or the former OAI, will be pronounced by Dr. Monique Ilwa, and I hope I pronounce your name not too wrong. She's a General Director of the WOA.
It doesn't work. Welcome. Nothing works apparently. Okay. No, thank you also to the president of IABS and the member of the scientific and organizing committee for organizing this important meeting as discussing on vaccines and vaccination strategies to prevent and control avian influenza really makes matter. So, ladies and gentlemen, dear delegates, because I'm pleased to recognize in the room several delegates, or former delegates, dear Madhu and representative of international organizations, dear OFLU experts, despite the mask, I recognize you, dear participants. Avian influenza continues to heavily impact all regions of the world, leading to significant economic losses due to the mass killing of birds. I don't know if the real situation is counted exactly, but according to the information reported by our members since 2005, more than 26 million poultry died, and over 380 million poultry have been destroyed for disease control reasons. Mass killing of poultry incurs huge cost to governments, of course, and industry. Heavy economic losses for farmers generates also a long-lasting impact on their livelihoods and raise societal and environmental concerns. Wild birds have also been severely impacted by the disease, including the endangered species, due to the high mortality, in particular over the last year. The consequence of avian influenza on wildlife could potentially lead to devastating effects on the biodiversity of our ecosystems. And we have also to keep that in mind. Over the last years, there has been substantive increase in number of high pathogenic avian influenza outbreaks. There is continued persistence of outbreaks in the past seasons in both poultry and wild birds. Countries have thus started looking into the various response options to tackle this new epidemiological situation. Conventional control strategies based on surveillance, stamping out, movement restriction, and biosecurity measures, whilst achieving success, we have to recognize that, in limiting infection and return to freedom from infection, may not be sustainable, and additional tools and options to prevent and mitigate infections may be required. Therefore, it is important to be in capacity to question which additional options can be available to prevent and control the disease, and consequently avoid destroying so many animals when food security is becoming a critical issue for many families. As you know, WA develops international animal health standards, which countries commit to adapt to their national legislation. The terrestrial code recognizes that vaccination can be used as an effective complementary control tool as part of a disease control program. And the standards on requirements for vaccines are available in the manual for diagnostic tests and vaccines for terrestrial animals. And the participation of Dr. Etienne Bonbon, President of the Code Commission, could be also helpful today if you have additional questions on those standards. The decision to use vaccination against avian influenza must be based on a strong analysis of health risk at regional and national levels, because the risk of spillover to humans cannot be neglected. It also needs to consider the international context, the potential economic consequences on active outbreaks, and the capacity of veterinary services to set up a vaccination campaign, because we know that in many countries, they don't have the human resources or financial resources for organizing such vaccination campaign and control also the post-vaccination. The constant evolution of avian influenza viruses thus calls for strong surveillance systems to get us the data necessary to develop efficient vaccines. Fortunately, we are not starting from scratch, and fruitful collaborations are already well established. I would like to highlight 3 of them. First, experts for the joint FAO-WA scientific network on animal influenza, the famous OFLU network, are looking into ways of further supporting countries to provide up-to-date information on characteristics of circulating avian influenza viruses, including comparisons with vaccine antigens. This information should facilitate the selection of appropriate vaccines for poultry and the update of poultry vaccine antigens in place where vaccines are being used. The second important cooperation is done through the global framework for the progressive control of transboundary animal disease, GFTADS, jointly managed by FAO and WA. And this framework coordinates efforts in the revision of global strategy of avian influenza, considering the evolution of disease and member needs. And I hope that next year will be well advanced and that we could start to share with you what could be this future revised strategy. And the last one, but not the least, WA is also strongly involved in the collaboration with FAO, UNEP, and WHO within the quadripartite to address health threats, and avian influenza is an important stress because that could be a potential candidate for a future pandemic. And therefore, we are together promoting health and sustainable development. So to conclude, I have only to highlight that many questions pertaining to vaccines, animal population, and socioeconomic aspects need to be further addressed based on scientific evidence, of course, before promoting a broader use of vaccines against avian influenza, because that should be very high on our agenda. And therefore, I'm really sure that this meeting and your inputs during the discussions will help to move forward. That is why I wish you really a very successful, fruitful meeting, and I'm really looking for the outcomes of the meeting. Thank you.
Thank you very much for this clear message. The final word Final word of welcome will come from Dr. Manur Dinga, head of the Emergency Prevention System for Animal Health of the Food and Agriculture Organization of the United Nations.
Thank you. Thank you, Monique. And this is actually the first time that I'm in WOA in person. So really happy to be here. So on behalf of FAO and the CVO, Dr. Keith Sumption, who was unfortunately not able to be here, I would like to thank IABS for organizing this meeting. And thank you all for being here and for those who are connected online. So I would like to echo Monique's word on the phenomenal impact that avian influenza has had on the world's food security and ecosystems. And again, highlight that conventional strategies that we have been used for control may no longer be sustainable. While the world had its eyes on the COVID-19 pandemic, avian influenza spread at an unprecedented rate. Both in terms of the burden of the disease and in terms of the geographical distribution. And Monique already highlighted the numbers. For FAO, avian influenza is a serious concern because FAO's mandate is food and nutrition security. Animal source foods such as eggs and poultry meat are an accessible and important source of protein for the poorest in the world. And because of that reason, such a high impact disease can be devastating for livelihoods, health, welfare, and the nutrition of those who already suffer the most. Smallholder poultry production is especially important because it is a pathway out of poverty for millions. Many countries that have been affected by avian influenza don't have compensation policies for producers, meaning that control measures usually equates to loss of livelihoods. And this is just the tip of the iceberg. There's always the constant threat of zoonotic spillover. And now HPAI is threatening biodiversity as an ecological niche has been established in wild bird populations. And there's a constant change in epidemiology and scientists are always on the back foot trying to understand what is going on. So FAO has supported countries to manage the risks of avian influenza since, I think, 2004, 2005. We have our boots on the ground in more than 30 countries where avian influenza programs are being implemented and country capacities to prevent, detect, and respond to the disease have been enhanced. Recently, in response to the avian influenza pandemic, FAO launched the virtual learning centers, which are learning hubs in 6 regions. And in response to the massive global spread of avian influenza, we immediately prepared and delivered a very high quality tutored avian influenza preparedness course. And some of the experts in that room were involved in the preparation of that course. Thank you very much to all of you. And as we speak, the course is being customized for delivery in South America to enhance the preparedness of that region. So yes, we are doing a lot, but is it enough? Or we need to rethink what we've been doing. WOA and FAO have worked under the framework of GFTADS, and now we're looking to revise the avian influenza control strategy, which was last updated in 2008, and much has changed since then. Monique already mentioned the quadripartite One Health Joint Plan of Action. And this joint plan of action will further enhance our efforts to enhance early warning and risk management. Now, risk management really starts at the producer level. Improving public-private partnership approaches to enhance biosecurity along value chains is key, especially in those countries where the disease is endemic and there are risky value chains. So this year, the FAO established a subcommittee on livestock within the Committee on Agriculture, within one of our governing bodies. The subcommittee on livestock requested FAO to enhance the resilience of smallholders through the development of a progressive management pathway for biosecurity. And we've developed that pathway, the framework for that pathway, and we will soon publish it. So the pathway, or the PMPB as it is called, it's a collaborative, stepwise, co-developed and co-owned approach to assessing and managing risks to animal production and health. supported by the provision of appropriate tools with shared public-private responsibilities. And the PMPB is specifically targeted at the smallholder sector and in endemic disease situations. And we hope that this pathway would help in managing the risks of avian influenza with incentives identified for both the public and the private sector. Vaccination is another tool we have. It has been used to control avian influenza in some countries, and there have been varying degrees of success. Many lessons have been learned, and I think now it is time to reflect upon them and learn from those lessons. Particularly given the endemicity of these viruses and wild birds, more than ever, we need to work together. The poultry sector, the vaccine manufacturers, government researchers, and we all need to do our bit to contribute to improving our collective knowledge. This knowledge can be used to enhance efficacious vaccine availability and the development of effective vaccination strategies. So off-loose avian influenza matching, tentatively, it's called AIM at the moment. They have taken the first steps towards this, drawing on the experience that the network has from the human vaccine composition meeting and other vaccine matching initiatives to see whether something similar can be developed for avian influenza in the poultry sector. But there are many parts of the puzzle that we still need to work on. So in order to maximize the usefulness of this activity, we need all of your collective inputs, whether you're in academia, industry, or government. VOA and FAO will continue to work closely together to fight avian influenza through the GFTADS framework, with the support of OFLU, and with our other One Health partners, WHO and UNEP. So I look forward to working with you during this meeting. I left the Diwali celebrations at home and came here. This is how important this is to FAO and to me personally. So I wish you all the best for a successful meeting, and thank you.
Okay, thank you very much. Before we go to the first keynote, Dr. Hill has a few administrative remarks for us.
Thank you. So some administrative words to share. Please make sure for those that are online, make sure that your microphone is off. For those in the room, as has already been stated, ensure your phones are silenced. We will be, for the most part, we will be taking questions at the end of the sessions rather than individual speakers, but that may vary depending on how we are on time and clarification that might be needed throughout the way. And if we don't get to your questions, we apologize in advance. For those that are online, please type in any questions or comments and use the chat box. The online participants are mostly listening, but they do have a venue or an avenue to share comments and questions, and Dr. Carmen Youngbeck will be monitoring those comments and sharing them with the group here in person. And at the end of the session, please take a few minutes to answer our survey. We're always looking to improve how we run meetings and conferences, and we would really appreciate your input. A final note about how we would like to operate for the next 2 days, especially in the breakout sessions, and that's the Chatham House rule. Essentially, it's to ensure that information that's received does not identify either the person or their affiliation. So we're hoping this will have an open dialogue and discussion as we move forward together. Before we get to our keynote, I thought it would be interesting to share just a little bit on the genesis of this conference. Thanks to the websites of FAO and the World Organization for Animal Health, the world has online access almost immediately to the global disease situation that we in this room are so familiar with already. Even today, after a very interesting summer, there's daily news. This comes from the American Veterinary Medical Association just a couple weeks ago about influenza cases in the US as birds are migrating. Similarly, in Europe, almost daily news is talking about this particular disease, hopefully inspiring us to come forward with some recommendations and conclusions. Another piece of the recent past happened not too far from here with the ducks that are used for meat or fattening, and the impact that this disease has had on them recently. So if we look to France in particular, the Southwest region, instead of depopulation, looking at other alternatives, this group has been helping with the genesis of this meeting, in particular, the Poultry Veterinary Study Group of the EU. So I'd like to thank them for bringing this to the world's attention. And a couple of individuals, Lenny Corrand, and a veterinary practice here in France, and Daniel Gaudry, advisor to IABS, who inspired us to bring this meeting together. I'd also like to acknowledge the scientific committee led by Dr. David Swain. I think you'll see that the panelists who have been very busy in advance of the meeting and discussing and preparing the panel discussion, and the breakout sessions to get your input. So it's a very unique style of meeting, and we hope that we get good participation. I also wanted to share that we hope to publish 4 distinct manuscripts related to this meeting, and their titles are listed here. IABS meetings usually have a full meeting conclusion and recommendation and a full meeting report. This will be supplemented by 3 specific topics. And finally, my challenge to everybody as we look to the future. We hope to develop some recommendations and conclusions here today, but I'd also challenge you to think about the next steps. The birds are going to continue to migrate. Where do we go from here if there's a recommendation that the world wants to follow up on? Is there a need for additional targeted workshops? Is there a need for a follow-up meeting on webinar? So please consider that as we wrap up the meeting tomorrow afternoon. Thank you. And I will turn it back to our moderator.
Okay. Thank you very much. We now go to our first keynote. Dr. Swain will set the scene by talking about vaccine uses to control HPAI and barriers to more effective use. Well, for the introduction of Dr. Swain, I would say, well, if anybody in this audience would not have to be introduced, it would be Dr. David Swain. He devoted his career in understanding and controlling avian influenza, both in poultry and wild birds. Hundreds of papers, chapters, books, many talks, advices, well, we all know you very well, and thank you very much, and the word is to you.
Welcome to the meeting, and I appreciate the attendance of each and every one of you here in person, but also we have another 100 people in virtual attendance online. So we're right at 250 people who see this as a critical issue for discussion and moving forward. So my job today is to set the scene and to give you some information to kind of begin the thought process of why we're here today and what we can do. So I want to go back in history because I think that is a critical part to help us understand. We had an outbreak in the United States, our first one diagnosed as foul plague or highly pathogenic avian influenza in 1924. This so happens to be the same year that this organization, World Organization for Animal Health, was formed for the very purpose of controlling many catastrophic animal health diseases. So in this particular outbreak, which I will go through, I'll remind you that in 1924, nearly 100 years ago, we did not have modern poultry production. At that time, all the production was in small operations. Most of those were less than 200 animals. There were a few exceptions around the world. There was the beginning of the layer industry with flocks as large as 5,000, which seems mighty small today, but very, very limited. So in this particular outbreak, we faced the issue of a catastrophic occurrence of a disease that was so destructive to the poultry population as to be of economic importance in diminishing the food supply. And this is a statement by the Secretary of Agriculture, Dr. Moeller, in 1924. And as a result of this, the U.S. approached this disease differently than we had approached other diseases in the past. We saw this as a emerged disease that occurred very quickly in the Northeast United States, and then developed an eradication model that was centered on the federal government doing stamping out programs based kind of on the original outbreak control of rinderpest here in the Europe. At the time, high-path AI was thought to be just a single virus. Nobody knew anything about DNA and RNA, about virus lineages. It's a very simple understanding of what the disease was. The other important thing was there was a dangerous character about this disease that warranted the radical methods for complete eradication within a few months. And that was based upon a clinical diagnosis of the case, which sometimes took enough time for the disease to be present in the flock in sufficient numbers to identify unique characteristics such as the cyanosis and edema of the head and systemic hemorrhages. Also, quarantines were imposed and embargoes placed and poultry shipping restricted. And this shipping was primarily in the United States along railroad lines. So this is all domestic issues. Slaughter and sanitization, disinfection of poultry markets was implemented. Some of those disinfectants were today not what we would accept as environmentally friendly, such as coal tar derivatives, which actually left the facilities smelling like coal tar, and subsequent flocks that came in tasted like coal tar. That would be not acceptable today. It would be very much an adulterant. Then there was diligent cleaning and disinfection of both the premises, the coops, the crates, and the carriers, and cessation of traffic in all live poultry. And destruction of any of the sick poultry with burning or burying of their carcasses. And the major preventative method used was isolation of new purchased poultry until proven healthy. And this methodology, this system has been in place for 100 years with some modifications, and I'll cover some of those towards the end to help improve the system. So if we look at a table, and this is a table just showing you since 1955, when Dr. Schaefer in Germany made the determination that highly pathogenic influenza was caused by a virus, an influenza virus. We've had 44 distinct epizootics that occurred. And we know that, yes, it's an orthomyxovirus. The hemagglutinin has the ability to mutate and drift, and that's an issue we deal with every day when we look at vaccines and we look at diagnostic tests, such as our real-time PCR. We know there are 8 gene segments in this virus, and that really makes the virus unique and different because those viruses can reassort between each other and produce reassortants or hybrid viruses that have different biological characteristics as well as genotypic characteristics. We know there are 2 main pathotypes based on infections in chickens, the low path and the high path. But I think most importantly, most distinctly over the last 75 years, we've learned that highly pathogenic avian influenza viruses are not a single virus. They're composed of multiple lineages of viruses that cause different outbreaks. And even in some outbreaks, if they stay on the ground long enough and infect enough birds, it creates multiple genetic clades showing the diversity of these viruses. And even within individual farms, you have mixed infections of quasi-species. They're not all identical. And we know other things. We know and understand the role of wild aquatic birds in the ecology and the epidemiology of low-path AI. This all originated beginning in the late 1960s and up into the early 1970s. And today it's a major part of investigations of looking at how these low-path viruses move around the world. We know that they circulate into many aquatic birds where they are the primordial reservoir for all those low-path AI viruses and their genes. And over time, through various exposures and adaptation of these viruses, they go into our terrestrial poultry where they adapt and circulate within them. And then some of these viruses will then move into a high path mode by that mutation of the hemagglutinin gene and circulate. But the thing we've known over most of these outbreaks is that once that high path virus emerges, or even the low path virus has adapted to poultry species, the terrestrial poultry, they usually don't go back into wild birds. It's been a one-way movement historically. And we know from that that the control methods have varied per strain and per country, depending upon their individual needs and resources. So there's not a single methodology applied across the world in every location as to low and high path AI. With the high path viruses, we have these emergent groups of viruses. These are strains where the low path mutates to high path. It's picked up very quickly in diagnostics. They're met with full force of quarantine diagnostics and stamping out, and those emergent viruses are eradicated and that lineage of virus disappears. But we also know we have some strains that have become entrenched. These are strains that in some countries have gone through the stamping out and eradication process, but other countries have had to learn to manage or control them because those viruses became endemic. And because of food security issues that Dr. Elia has just mentioned, is that vaccination and other programs have had to be implemented to feed people around the world, primarily in low-income countries. And I'm going to give you some examples. The first example I'm going to give you is an emergent virus. And in the month of March of 2020, just a few years ago, we had 11 of our commercial turkey breeders or meat turkey flocks in North and South Carolina occupying 3 different counties where detection of H7N3 low-path virus occurred. In doing the genetic analysis of this, and this is a network analysis looking at the full genome of these viruses isolated from turkeys, and these are from multiple houses on multiple farms, we could identify there was a single introduction from the North American wild bird reservoir of this low-path AI, and then it spread laterally between those farms in these operations. Then there was a single low-path to high-path AI mutational event in that hemagglutinin gene, that mutation I mentioned before. It occurred in one of the South Carolina farms without secondary spread, and it was contained on that particular farm, but also on that same farm with a high path mutation, there were other houses and even individuals in the same house with a high path mutation that had low path, just confirming this change that can occur from H5s mutating from low to high path, and that's what happened. In this process, not only was the high path affected flocks depopulated, but the same thing occurred also on the low path ones, and they were all eradicated in a short time of less than 3 months. So the next thing is just to kind of go back and rethink about this whole idea of entrenched. What is an entrenched virus? And although I mentioned our understanding, it was developed through the 1960s, one major event really changed our understanding of some high path AI viruses. And again, just emphasizing not all high path AI viruses are the same. In this case, we'll talk about the H5N1, which now we know reassorts, and it's H5NX because there's been H5N2s, H5N3s, et cetera, of this lineage. It's a Eurasian lineage virus. It's been given the name goose guandong. But this particular virus has been around for 26 years. And the uniqueness of this virus is that it has, in its natural history, evolved such that there has been exposure in the live markets and market production systems, not only of terrestrial poultry, but also of aquatic poultry, of ducks and geese. And that virus had maintained that adaptation to both terrestrial and aquatic poultry. And not only to the domestic side, of course, domestic ducks are the same species as mallards, but also allowed infections in a variety of aquatic wild birds. It so began the cycle, this off and on cycle of infection of wild aquatic birds and their movement of the virus between geographic areas by their normal migratory patterns. So when we look at some of the bigger issues, we say that if you look at this single virus lineage, which has been around for 26 years, it's affected more poultry than the other 43 high path AI disease events combined that I listed in that previous table. There have been over 84 countries where this virus has affected poultry, wild birds, and/or human beings. It's the largest and longest high path outbreak since the 1900s, when foul plague had spread across Europe, causing infections also in Asia and in Africa and South America. There's been extensive drift in the hemagglutinin gene of this virus and reassortment, not only of the neuraminidase, but also of almost all the internal gene segments, which has really impacted the ecology and the epidemiology of this epizootic virus. So when we look at wild birds and the involvement of this virus, there have been variable outcomes depending upon the virus strain, the host, and other physiological and/or environmental factors. With the outcomes early on in the infections, beginning in 1996 and 1997, Experimentally, if you gave the virus to those aquatic birds, usually you saw either no infection or asymptomatic infections, or maybe some mild clinical signs. As this virus progressed in its natural evolution in the wild, those viruses, when brought into the laboratory, would cause more severe illness and even death. And in 2002, we had the first noted major deaths. These were in Hong Kong, in a couple of the parks there, of captive waterfowl of the same species as we see in nature. Experimentally, if we look at those different viruses, different clades, and different individual strains, we could see that variability in those viruses and how they would affect wild birds. I'll just show you an example. This is just one virus, the whooper swan Mongolia virus from 2005. It's clade 2.2. In 2005, if we took that particular virus and gave it to very young mallards, 2-week-old mallards, it would cause 100% mortality in less than 5 days. If we took the same virus and used little older birds, and you can see here we have mallards and several in green of other dabbling ducks, we could produce infections without clinical disease and shedding of the virus, makes them ideal host for movement and spreading that virus during that acute infection period. But not all dabbling ducks were conducive for this situation. For example, wood ducks, which fit a different ecological habitat. Infection by this virus was because it was called highly adverse events, including illness and death, and then with much higher replication titers. But we also look at other species of birds, and here I'm going to talk about swans and geese, and go back to that 2005-06 timeframe, and remembering that was the first movement of the virus into Europe. At the head of that movement were wild birds, and the mortality in various species of swan was one of the most prominent wildlife issues that occurred at the time. And experimentally, that's been reproduced with this particular lineage of virus of the high morbidity and high mortality in all 4 major swan species, but also the same thing in geese species. So if we move forward and talk about how's it impacted the world as far as animal health, poultry health, and cases as reported to the World Organization for Animal Health. And here I have on the top a bar graph representing the number of cases or premises that had outbreaks beginning in January 2005 up until June of this particular year. And when you compile all those, it's 25,378 cases. The vast majority of those reported cases involved this H5N1 goose guangdong lineage virus, followed by the Eurasian H7N9, and followed by the H7N3 North American lineage virus. Those are the 3 entrenched viruses we face globally today. And a much smaller number of outbreaks were the emergent H5s and H7s, which were rapidly eradicated by the stamping out in high-income countries. If we look at the bottom chart, which is the number of birds that were affected, you can see there are multiple peaks. And these really correspond to the movement of the H5N1 goose guangdong virus transcontinentally. The first movement was the clade 2.2 in 2005, followed by the clade 2.3.2.1 in 2007, 2008, then followed by the large outbreak that we also experienced in North America, 2.3.4.4C. Then in 16-17 is the first outbreak of 2.3.4.4B here in Europe, and then followed with the big outbreak that is still ongoing beginning in the fall of 2020 of 2.3.4.4B. Again, this one actually crossed multiple continents involving both Asia, Africa, Europe, North America, and now we have at least preliminary confirmation of some viruses in South America. Those are still pending clarification and confirmation by a WOA reference laboratory. So if we look at a global map, and you can see the red where these were confirmed cases up through June, we'll see that since the fall of 2020, this 2.3.4.4B virus has moved from Central Asia into Europe, into East Asia, down through the Middle East, and into Africa and back up. And then most recently, beginning the late fall of 2021, across the Atlantic Ocean into North America, with bidirectional movement of this virus from Africa back up into the Middle East, Asia, and Europe. In June, if you compile the number of cases and the number of poultry affected, it was 5,771 cases, affecting 155 million poultry, either those that were culled or had died. When you compare between just Europe and the US, you can see that over approximately 2 years in Europe, it affected 36 countries. In just the 6 months, it affected 38 US states. The number of outbreak flocks is almost 2,400 in Europe. We had almost 400 in the US in our 6 months. You look at the numbers, culled and dead, 46 million in Europe, 40.1 in the US. And you look at the wild birds, which is really the astonishing number. These are just confirmed numbers of wild birds with HPAI, 2,733 in Europe and 1,826. And those numbers since June have climbed higher. It is an ongoing outbreak. If we reflect and just look at North America, which involves cases through the spring and the summer into the fall of both Canada and the United States, you'll see that in North America, we've had 4,338 wildlife cases. That's as of the 12th of October. 706 domestic bird cases / premises. That was 174 in Canada and 532 in the United States. 50.57 million poultry affected. That's 3.12 million in Canada and 47.45 million in the United States. It has such a huge, broad geographic distribution, just 9 months. The eastern edge, which was the entry point, was the Avalon Peninsula in Newfoundland, Canada. As far west as the Aleutian Islands, as far south as the southern edge of Florida, and as far north as the northern slope of Alaska. This is a huge geographic area for this virus to spread in just 9 months. In total, 47 US states have cases in wild birds or poultry, and in Canada, all 9 provinces and 3 territories. So just a few epidemiological graphs to show you. The top one is the outbreak we experienced in 2014-15. It was a triphasic with the Pacific flyway affected first, mainly wild birds and a few backyard flocks and only 2 commercial flocks. Then in the middle of February, 1st of March, this spread into the Midwest, starting to have outbreaks in poultry, commercial poultry operations. Those were introductions from wild birds. And then the large curve at the end was those cases that involved the Midwest, which were primarily onward transmission of the virus between farms in a lateral transmission mode. We know in comparing the outbreak from 14-15 with the 2022 outbreak, the commercial and backyard birds, the epidemiological curve shifted to the left and had higher peak than the 2014-15 and is ongoing. So it was not eradicated as the previous outbreak. The 2022 commercial outbreak has lasted longer than that 2015. We've had a higher proportion of our commercial flock, backyard flocks that have been affected compared to the commercial flocks of 22 versus the previous outbreak. The numbers are 52% of our outbreaks are in backyard flocks versus 9% in the previous outbreak. And then there's a greater number of wild birds affected in that timeline. If you put them side by side, you can look down through the numbers. But I think the really critical issue to look at is the wild bird cases. So in 2014-15, we confirmed only 98 positive wild bird cases. And the number of states affected were only 15 as far as having those wild bird cases. But if you look at the current outbreak, we've had 45 states with wild bird cases, and that's 2,930 cases as of last week. That's a huge difference in the ecology of this virus than the previous outbreak. This virus has greatly changed in the last 2 years. But it's not just talking about aquatic birds that migrate and their impact. There have been some unique occurrences of die-offs in wild birds and collies. For example, in Senegal, there have been die-off of rose pelicans last year. Last fall, through Israel, the migration of common cranes, there was huge die-offs in the Hula Valley. This past summer in Europe, multiple colonies of a variety of species in Northern Europe had die-offs of large numbers of fledglings as they were reproducing this summer. And for us in the United States, we've had major die-offs in both black and turkey vultures, an individual roost all across the country. A huge negative impact on wild bird ecology. But also this virus has changed what we've seen. This is a network map from our previous outbreak, just to show you, and of course on the left is the early time point introduction of the virus. On the right is the last of the viruses in the outbreak. In this particular outbreak, in initial stages, the viruses were transmitted from the wild bird reservoir into the domestic poultry, in backyard flocks, or in commercial poultry. But the beginning of the spring, beginning in April in the Midwest, this changed, and the virus began to be spread between farms by human activity. And so these were lateral transmission. In fact, the vast majority of the commercial poultry outbreaks beginning in that springtime were this lateral transmission. In contrast to the current outbreak, and at least the preliminary studies that we've done have indicated this has changed. This is not the same type of virus. This time around, the vast majority of our commercial strains are more closely linked to the wild bird viruses, and only a small percentage of those, somewhere around 22, potentially have been transmitted laterally, onward movement of the virus between farms. A completely different change epidemiologically than we had in 2014-15. This virus has changed. So if you think back, how do we prevent it by biosecurity? And this was really kind of implemented in 2014-15, but it's really emphasized today. Previously, throughout our history, from 1924 on, we always saw the movement of HPAI as movement of an agricultural event, movement from farm to farm, through fomites, through human activity, through sharing equipment, et cetera. And so you establish the gate of the farm as the cutting off point. That's where you would stop people from coming in and bringing the virus. But we know today, with the wild bird involvement, as well as in 2014-15, but really in this current outbreak, is that point of biosecurity has to be the front door of the house, because you have wild birds that can be anywhere around the outside. They don't observe the fences that we have put up. And also, it's a change in the number of cases that involve mammals. And those mammalian cases have been quite variable. By far, the most common cases have been in red foxes in Europe and North America. But also, we have had a large number of cases in harbor seals and other seals, and sporadic cases in other carnivorous and scavenging animals, and rare human cases. So the question comes up, why would somebody consider vaccination? And to review for you just a little of the science, there's increased resistance to the avian influenza virus infections with vaccination. There's reduced avian influenza virus replication in both the respiratory and the GI tracts, which reduces shedding and also prevents disease and death in poultry. With the reduction in that shedding, it also reduces environmental contamination and reduces spread between premises and reduces transmission to birds and improves animal welfare. All of these are critical issues that vaccine can assist. But vaccine adds this additional layer of protection on top of the other biosecurity measures that should be implemented and observed on all farming operations. But it does not by itself replace those biosecurity measures. It's an adjunct to them, but it's a tool that can be used to enhance those features of biosecurity to reduce the potential for infection. And I want to share with you just one experience. This is a large company in Connecticut, and it was a low pathogenic H7N2 virus that caused infection in this multi-farm operation, 7 farms, 1 company, 4.4 million birds. The USDA had requested at the time of the outbreak that the farmer do voluntary depopulation, of which there was no indemnities at the time. The state government came up with a plan involving the company and developed an alternative that would prevent spread of the virus and eliminate infected birds. The basic strategy was to isolate the farm through biosecurity practices, increase the immunity in the infected layers by a single vaccination. And at the time, there was only 1 kill vaccine available, and it was the same neuraminidase subtype, H7N2. And then they would begin replacing each of the houses one by one by vaccinated pullets that were twice vaccinated with an H7N3 vaccine that of course differed at the neuraminidase from the outbreak virus. and then established a monitoring program by house and biosecurity between houses. And they would do unvaccinated sentinels. They do serology monthly, and they would screen the mortalities that were collected 1 day per month, and also developed a DIVA strategy to look at the neuraminidase testing. I think the most important emphasis and the most important outcome of this particular endeavor, this 2-year issue looking at low path AI, was that detection of silent infections was extremely rare. This implemented in May, this vaccination program completed in the first part of June, and the last positive was found on June 26, 2003, and 2 full years of surveillance found no more virus in this flock. In this case, silent infections did not exist because of proper vaccination, proper monitoring. This facility was declared AI free in mid-2005 and vaccination was stopped. When we look around the globe and we look at vaccination and discuss vaccination, there have been 14 countries that have vaccinated poultry against high-path AI from 2002 to 2010. And they used 3 different types of programs. There were a series of countries that used this as a preventative in the early part of the 2000s, including Mongolia, Kazakhstan, France, the Netherlands, and Hong Kong's special administrative region. There was also some usage during that same timeline as an emergency vaccination in the face of outbreak. Côte d'Ivoire, Sudan, North Korea, Israel, Russia, and Pakistan. And they didn't use the same program. They used different kinds of programs to meet their individual country needs. And finally, the bulk of the vaccine, which has been used in mainland China, Egypt, Indonesia, and Vietnam, for them because the infection was already endemic within their countries, and they began the vaccination program for food security reasons. And then we can add to that Bangladesh and Mexico with official programs. And that's where 99% of the vaccine has been used. But I want to emphasize, it can be used as a preventative and it can be used as an emergency vaccine, and it has been in the past with success. So what has changed in the past? I want to use just 25 years. There's lots of changes in 100 years. What has changed in the last 25 years to say, hey, the time is right to consider another change, more widely use of vaccine? First thing is we no longer use clinical diagnosis for high-path AI. We no longer use tissue culture or embryonated eggs to identify high-path AI. We do it by molecular testing, real-time PCR. And that test can give us an answer so quickly that we can impose a quarantine in less than 24 hours. And we can depopulate in less than 24 hours. We can stop this infection cycle earlier, and it has greatly improved eradication strategies and programs. That's the first issue. The first one is we now have a molecular definition of high-path AI. So we can, by sequencing the virus as soon as we identify it, determine if it's low or high path and take corrective action if it is a high-path virus. We have improved methods for depopulation and disposal that are faster and more environmentally sound. We have implementation of vaccination programs for high-path AI. That includes reverse genetic vaccine strains for antigenic matching to the field viruses, so they're not divergent anymore. We have laboratory and surveillance methods to assess both vaccine and field virus for updating of vaccines and keep them matched antigenically. We have the acceptance and issuance of regulatory processes to allow the cassette concept to rapidly update non-replicating registered vaccines so we can keep them matched to the field strains. We have recombinant vectored vaccines that produce not only humoral immunity, but also cell immunity to give us better immunity and better protection in the field. We have hemagglutinin-only based vaccines, which support serological DIVA strategies. And we also have improved adjuvants for enhanced immune response. All of these are changes that science has contributed to help in high-path AI control. So why are we having this meeting? First, the change in behavior of the H5N8 Eurasian lineage high-path AI virus dictates that we not keep doing the same thing over and over again. The virus has changed, we need to change. The effects this is having on our production systems is tremendous. For example, the compulsory housing orders of organic poultry that are brought indoors. This really changed the control programs we have. There's a need to explore options to reduce the massive losses of birds and high cost to industry and governments from these outbreaks. There's the uptake of vaccination has been slow with reliance solely on biosecurity in response to infections. And as we've seen from the number of outbreaks in just the North America and Europe, you can see that biosecurity alone has not stopped this virus. We recognize that there are several barriers to vaccine, and we're not trying to fool ourselves that this can be done and overcome immediately. It's going to take some discussion, identifying those barriers, and finding real solutions that are going to work. And we can do it. A change is occurring in our thinking towards vaccination, especially in places that have experienced repeated wild bird introductions and epizootics in poultry. And finally, there's mounting citizen pressure against massive depopulation. We can solve this problem. And there's a whole host of issues that are identified as barriers. And we're going to talk about these over the next 2 days. You're going to talk about these. You're going to bring them forward. But also, as we find a barrier, there's always a solution. So it's our opportunity to find those solutions and bring them forward. So we're going to, throughout these next 2 days, have detailed coverage through a series of presentations of different parts of control programs, including the barriers. We know that many countries have been reluctant to use vaccine even to improve food security, which includes some countries that have H5, HPAI endemic. In some endemic countries where vaccination is not allowed, there's also some illegal vaccination of unknown quality going on. We need to correct that. We need to get, if that vaccination continues, it needs to be high quality vaccines. We've learned that over the last 20 years. Don't use poor quality vaccines. It only makes it worse. Good quality vaccines work. They help solve the problem. There's been several issues that inhibited the use of vaccination in places with a zero tolerance for infection, including things such as trade restrictions. Silent infections have been discussed. Antigenic drift, complications to existing surveillance systems, and fears the use of vaccine will result in endemic infections. Some of these are true, some of these are not true. Some of these are an overextension of what the issue is, and some of them are resolvable. So how will this meeting be structured? If I can keep my notes, right? So we're going to have a series of presentations covering the issues described above, kind of as in the beginning. And then we'll have 2 sessions in which panels have been tasked to develop vaccination programs for specific scenarios and mock countries. The first panel will consider solving 3 common barriers in a poultry vaccination program. And the second panel will consider an emergency vaccination in a North American country based upon scenarios similar to 2014 and 2021 introductions by wild birds. Then after each panel, there will be breakout sessions. And these we'll have 5 breakout sessions involving everybody in this room. And everybody will be assigned to go to a breakout session where you get a chance to consider the programs presented by the panels and suggest alternative approaches. The findings from these breakout groups will then be provided back to the panels for a final round of discussions. In the meeting, we'll also hear from several countries with endemic infections. It'll be towards the end tomorrow, where vaccines have been used by them and the lessons that they have learned. Then at the end, we'll summarize all the findings from the meeting in a wrap-up session. And finally, the findings from the meeting and several companion papers on surveillance, barriers to vaccination, and vaccination will be published. But I remind you that our goal is to find ways to overcome barriers to vaccination. And we are expecting you to help us in this task. Thank you.